and cardiovascular disease. Please welcome Dr. DEEPAK JUMANI, sir.
We are all born out of love and sex. Sex is not a secret. Even a small kid knows about it. It's a sacred song of our soul. Though sex is a part of our quality of life, but it's life. We talk about HbA1c, we talk about piles, we talk about fissures, we talk about white discharges, leukorrhea, everything. But when it comes to sex, there is a silence. And this silence is the biggest risk factor. Sexual dysfunctions, friends, are not uncommon these days. They're very common. And these are vascular in origin. And the endothelium, which is the innermost lining, is the brain of our vascular system, gets affected. And there are stresses: diabetes, hypertension, obesity, dyslipidemia, smoking, so many things. And we all are aware that India is almost the diabetes capital of the world, and cardiovascular diseases are the highest ranking mortality across the globe. In men, erectile dysfunction is the earliest marker of diabetes, and of course it's vascular in origin. This signal is much earlier than the coronary arteries get blocked, at least 5 to 10 years. This is a soft signal, soft whisper, which we need to ask our patients. If we don't ask them, we see them in the ICU later on. So according to me, this symptom of erectile dysfunction is my ECG or my angiogram. In fact, bedroom is my cath lab. So once he tells me, or if I ask him at the age of 20, between 20 and 25, do you have problems in making love? To patients who have a family history of metabolic syndrome, this will give me a greater signal. And if I'm aware, I need to take care of him and prevent the critical events like myocardial infarction or stroke in his life. In this next 30 minutes, I requested Dr. Ashutosh for 30 minutes. So I'll give you some distilled insights and nuggets of wisdom as to the understanding of what actually happens. With pranams to God and thanks to my teachers, Dr. O.P. Kapoor, Prakash Kothari and Shashank Joshi, I beseech them to bless me always. My aim here is at my heart, this talk stands on a human right, the right to every individual to age with ideal health and satisfying sexual life. Friends, our body is a biological machine in action. Diabetes and pre-diabetes is in hyperinsulinemia and inflammaging processes. And it's the biggest sexual health tsunami of our century. I call diabetes a manageable, malignant, metabolic malignancy. It's a perfect storm, both these. We have risk factors of type 2 diabetes and same almost. And what are the effects of hyperglycemia? In fact, they are all together. A beautiful study done in 2024, published in Journal of Cardiology, 20,000 patients over a period of 11.5 years. They proved that the risk factors for both are same. Diabetes damages the vessels, there is plaque building, coronary artery disease and stroke. Nerve damage, we all are aware of it. Peripheral neuropathy, hearing deficiencies, diabetic neuropathy and erectile dysfunction have the same pathways. Cortisol increases, stress increases, and there are structural changes in the clitoris and in the penis, which we see in diabetics. So friends, we are all aware, this is the corpora cavernosa, and this is the innermost lining of our vascular system, the endothelium. Endothelium, if it is normal, produces nitric oxide, which is the molecule of life. This is the main molecule which enters into the corpora cavernosa, converts GTP into cyclic GMP. This cyclic GMP relaxes the smooth muscles and allows the blood to flow in. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of another enzyme, phosphodiesterase 5. So today, if we look at our armamentarium, we have PD5 inhibitors in the form of sildenafil, tadalafil, vardenafil, udanafil, and now new kid in the block, avanafil. But to reach here, you need nitric oxide. So if you give your patients PD5 inhibitors like sildenafil, tadalafil, you are giving them nothing to cure. You are giving them, it's like giving paracetamol to your patients with enteric fever, which is absolutely unethical. In diabetics, we see cavernosal endothelial dysfunction. There's definitely a link. Not only endothelium gets screwed in diabetes, it's even the mitochondria gets affected. Even testosterone is deficient in diabetics. So traditionally, the mechanisms of sexual dysfunctions in diabetes are endothelial dysfunctions, mitochondrial dysfunctions, diabetic neuropathy, hypogonadism, depression in most women diabetic, and of course the damages to the blood vessels. Montessori beautifully proved the smallest artery in our body is the penile artery. Coronary arteries are larger than them, femoral and the other arteries are still larger. So when atherosclerosis sets in, the penile artery gets blocked by 50%, it produces symptoms of ED. But the same amount of atherosclerosis doesn't occlude 50% of the coronary artery to give the symptoms of stable, unstable angina or infarct or stroke. What do we learn from this? And we know atherosclerosis is progressive. Sooner or later, this will also get blocked. The duration between this and this is around 5 to 10 years. Okay. So these are the epicardial arteries which are seen on the angiogram, but the microcirculation is not seen at all. A beautiful study showing that right coronary artery is blocked, but this patient had a normal stress test, but he had ED for 6 months. So even cardiology now says that ischemia with non-obstructive coronary artery disease, angina with non-obstructive, and even myocardial infarction with non-obstructive are linked to coronary microcirculation, which cannot be measured. But what we can measure is the symptom. These patients have a symptom of this. The penis is the most honest organ of our body. So it tells you the honest thing, yes, you are at a risk. So in fact, ED is subclinical cardiovascular disease. In diabetics, the first thing to get affected is erectile dysfunction. So let's think deep. Long before the heart fails, long before the coronary plaques rupture, the penis whispers. Penis whispers today, the heart screams tomorrow. The endothelial derived nitric oxide is an anti-atherosclerotic and anti-thrombotic molecule. This decreases as we age, and when there is a loss of nitric oxide, it produces atherosclerosis. So the bottom line of male sexual dysfunction, ED, is it is endothelial dysfunction, mitochondrial dysfunction, and nitric oxide deficiencies. 3 brilliant scientists who won the Nobel Prize in discovering nitric oxide, Robert Foucault, Louis Ignarro, and Farid Murad. I was fortunate to meet Farid. Now this is the normal endothelium, and this is how the blood flows. That's because of nitric oxide. So this is just to show that the real-time effect, that how the nitric oxide, when it is not available, the macrophages and the neutrophils get stuck to the innermost lining, and they form like a Velcro. But when you give them nitric oxide, they all get. So L-arginine, which is a nitric oxide donor, we need to understand, is available to us. So the need of the hour, how to get nitric oxide. There was a beautiful discussion on the oral hygiene. So 50% of nitric oxide you get it from L-arginine. The rest you get it from a diet which is nitrate-rich diets like beetroot, green leafy vegetables, nuts, pomegranate, watermelon, citrus fruits. Now these nitrate-rich foods if you have a normal microbiome in your oral cavity, will get converted into nitrite and then nitric oxide at the oral. This is the second way you can get nitric oxide. So you need not worry that your nitric oxide is. The third source of nitric oxide is your paranasal sinuses, which are the reservoir of nitric oxide. So deep inhalations, deep breathing, as we say, reduces stress, etc., lamba sans flow, it's science behind it. And we also can get by chanting mantras. Ayurveda and these have got mantra, tapasya, chikitsa also. So we've been treating ED for donkey years, but we don't treat the pathophysiology of these. There are limitations, there are side effects, 50% patients don't respond to it. The normal therapies which we have are PD5, testosterone, vacuum, all these have complications. So patients want something efficacious. And what we can do ethically is to restore the endothelium and the mitochondria and the nitric oxide to be supplemented. So the risk factor of all risk factor is endothelium. We have strategies to improve the endothelium. Dr. R.D. Lele, late Dr. R.D. Lele, my teacher, showed so many strategies. For diabetics, if they have mitochondrial dysfunction which causes weakness, we have imeglimin which is available in the dose of 1 gram twice a day can be given to them. So if we have to give holistic approach to patients with sexual dysfunctions and diabetes and cardiovascular, first we should not do any harm to them. Second, we have a beautiful diet. All red colored fruits, vegetables, all greens, beans, berries, avocados, seeds, saffron, garlic, onion, ginger, almonds, walnuts, honey, dark chocolates, cow's ghee, cow's milk, vanilla. But most important, I don't give any diet to my patients. Even the best dietitians in Mumbai, Dr. Sarita, she said nobody adheres to that. I just tell them avoid excess of salt, oil and sugar. Because if he takes excess of salt, he gets hypertension, medicines for lifetime, sexual dysfunction, and it's a killer. If he takes a lot of oil, he gets dyslipidemia, medicines for lifetime, sexual dysfunction, and again a killer. And sugar, the same thing. Avoid smoking, sleep 7 to 8 hours, fasting 12 to 16 hours, walk for 30 minutes, check for oral hygiene. Don't go by the recommendations once in 6 months. Every time your patients come to you, check his feet, check his retina, and check his oral hygiene. We all have biological switches in our body which change the whole thing, which increases the longevity, and they are not expensive. You don't have to buy from outside. One of them is sirtuins. If you restrict the calories, you activate sirtuins in your body. There are 7 sirtuins. These are anti-aging amino acids which are present, inherited in our body. They get activated only when you restrict your calories. That's the first switch. A lot of studies to prove. The second is autophagy. Restrict your calories. The clutter in your cells will get cleaned up. It's like you're sleeping in a room where there's a dustbin and you keep on pouring every time the dust or the kachra in it, and you don't clean it for months together. How do you feel? But we have an innate mechanism in our body which cleans the whole clutter of the micro DNAs, the spoiled mitochondria, all organelles, they can be cleaned. So that's we have. The winner, the discoverer of it got a Nobel Prize. And the last is hormesis. This is a beautiful master principle. Whatever you take a little stress, which is more than what you've been doing before, will make you live longer. If you're taking a hot water bath, at the end of hot water bath, just take for 30 seconds chilled water bath. 30 seconds, put it on your hand, body, and see the difference. And if you repeatedly do this, you will get accustomed. Your body will start repairing, rejuvenating, renovating, and adapting to the new thing. That is what is our secret. Our body is made up of cells, and our cells are capable of doing all these things. So to activate healthy sex life, you need all these things. We have L-arginine, we have fenugreek. Fenugreek is methi, and it is exactly like testosterone. It displaces the globulin bound and makes free testosterone more available, and you have desire with these patients. So my new thing which Dr. Ashutosh asked me to say, friends, no Indian have died of doing sex while performing sex. Nobody in the world, there are no data to prove that. Even JAMA produces sexual activity triggering mark is a very rare thing. It is only when you have an illegitimate partner, if you're drunk, if you're overeating, you get this infarct or whatever you can get it. So sexual activity in angina is only less than 3% of patients get it. With sedentary patients get myocardial infarction very fast. Patients with VT, 6,000 autopsies, no VT is available. When do you begin sexual activity? These patients keep on asking us. If you've done, if it is post-myocardial infarctions and conservative, 6 to 8, after angioplasty, these are AHA guidelines, 6 to 8 days, with post-bypass, 6 to 8 weeks, and post-robotic little earlier. There is a fear in every woman, you know. My husband has undergone a bypass, abhi sex nahi karne. No, in fact, he's become more younger, his coronaries are more clean, he will not die soon. So cheer them up that you become younger, nothing wrong in that. You know, it's an anxiety. Anxiety is just a fear, and to conquer any fear, you must do what you're fearing about, you know. We have a beautiful drug called Avanafil, which you can give to your patients who are on nitrates. The beauty of this drug, it's got the least side effects. The onset of action is only 15 minutes and its half-life is 5 hours. The most important contraindications of PD5 inhibitors is nitrates. If your patients are nitrates, you can't give them PD5 inhibitor because they'll end up in hypotension. But this drug to give is very beneficial, because if you want to have him good quality of sex, ask him to skip nitrates on that day, take Avanafil. He will have onset of action in 15 minutes. This drug will wash out in his body after 5 hours, and next day again he can start with his nitrate. So Avanafil is the only PD5 inhibitor which you can give to your patients who are on nitrates, but only caution is ask them to skip nitrate. Studies have proven that. If you don't want to give nitrates, you can switch them on ranelozine, which is a beautiful drug. A different mechanism, doesn't cause hypotension. So let's think. Dean Ornish proved that intensive lifestyle can reverse the coronary artery disease. Cleveland Clinic has proven that nutrition is the only intervention which not only halts but even reverses the coronary artery disease. Lifestyle modification improves the pro-inflammatory status, insulin resistance, oxidative stress, endothelial dysfunction, and reduce burden of section. Friends, nutritionists are sitting here, ask them, medicine is not healthcare, food is healthcare. Medicine is sick care. Trust me, improve your nutrition. I'll disclose you something beautiful today. This is it. Dr. Linus Pauling won 2 Nobel Prize. Who gets Nobel Prize? This brilliant scientist at the age of 60, when he received his 2nd Nobel Prize, announced to the world that nearly all diseases can be traced to a nutritional deficiency. So my take is, you will fall sick only for 2 reasons. One, what you put in your body, and what you do for your body. So this is a prescription for a patient who's got sexual dysfunctions. SGLT2 inhibitors, metformin, acarbose, imeglobin will take care of. Low dose tadalafil you can give him. Avanafil is again better. Testosterone replacement therapy if they've got no prostatic issues. Antihypertensives, don't give them beta blockers. If at all you want to give them nebivolol. Don't give them diuretics, give them indapamide if needed. Statins, lifestyle modification, friends, is not just 2 months, 3 months, it's for lifetime. Please add it. Lifestyle modification is for lifetime. You may be Hindu, Muslim, Sikh, make lifestyle modification as your first religion. Because if your body is good, you can follow religion again. Vegetarian diet, avoid excess of salt, oil, sugars, sleep for 6 to 8 hours, fasting for 12 to 14 hours, reduce stress, quit smoking, and no substance of abuse, check for depressions. My last 2 slides, friends. Aging is not inevitable. It's a relationship with yourself. We all are going to age chronologically, but we can reverse our biological age. It's not your enemy, it's your natural rhythm. Your joints, be happy with the wrinkles you have. You lived up to 70. Who lives up to 70? You be happy about it. So don't worry about it. Don't worry about the genes, etc. Nutrition, lifestyle modification, and the other ingredients of erotic brain. When you rest, you rust. So don't be sedentary. Aging is a condition, and we all can manage conditions. So cardiovascular disease is the major cause of mortality today. Diabetes is an inflammation. We all are in an inflammatory states. We need to see we don't go into the pre-inflammatory stage if we don't drift from our lifestyle. Muscle is anti-inflammatory, fat is inflammatory. So what does the logic say? Increase your muscle. build muscle and burn fat. So these are 4 PD5 inhibitors we have. They don't increase the desire. Okay. And for 40 to 50% don't respond to this. Then we give them testosterone, but we can't give it to younger patients for azoospermia, elderly, for heart failure and disease. So who's the Raja of all? Lifestyle modification for lifetime. Activate serotonins, autophagy and hormesis. Friends, last slide. We men have issues, women don't have issues. Right? Women is a miracle of love. She's the best masterpiece of God. Cannot be compared to anything else. We are all born out of her. Okay. So 4 vitamins which we all need to take every day and understand it. First is vitamin F. We need to adore, admire, trust and respect feminism. She has desires too. We only don't have. If a man who doesn't respect, adore, admire feminism, I pray to God that he should get irreversible, incurable erectile dysfunction. The second vitamin is touch. We hardly touch each other. Third is romance. There is no GST on romance. Why you don't? Romance should be till the end of your life. And last is gratitude. Be thankful to Almighty for whatever He has given you. These are 4 books of mine. I can send it to anybody. A book on nitric oxide, which is the best. You can send me an email. I can send you the PDF anytime. My last slide. Erectile dysfunction is a window to diabetes and coronary artery disease. Long before the heart sends a warning, the penis writes the first chapter of vascular disease. Diabetes does not raise sugar. It slowly steals the blood flow of intimacy. Erectile dysfunction is the body's silent whisper of an incoming cardiovascular storm. Listening to the whispers of our biology is preventive diabetology and preventive cardiology. Treat the root cause, the endothelium, mitochondria and nitric oxide deficiencies. Nitric oxide is the molecule of life. Lifestyle modification for lifetime is the key to longevity. If you do that, friends, sexual dysfunction in diabetes and cardiovascular disease can be managed. And trust me, sex really has no expiry date. Thank you all for your love.
Thanks, Dr. Jumani. What a wonderful lecture in this ancient city of Lord Shiva. I am encouraged to...
The Shivaling is the symbolic of that. Sir.
Yes, I am encouraged to just...
It's not, see, sex is not dirty, it's not awkward.
No, it's not.
It's the most sacred thing. It's the only, we have made robots, we have made blood, we have made tissues, but have we made a man who has emotions? No.
I take off my shoes before I chant one line from the Rudrabhishek, which is really a part of the Shukla Yajurvedam. Ahamajani garbhatvama tvamajasi garbhatvam. Translated into simple English, it is a prayer to Lord Shiva. I worship your manliness and please maintain our manliness. Thank you.
Last 2 sentences I would say. If we want to live happier and healthier, our religion says, Jaisa an vaisa man, or Jaisa man vaisa tan. So if you want your tan to be healthy, an should be healthy. So nutrition is the key, friends. No medicines, no gadgets, no protocols, nothing is going to help you, friends. Come what may, make your nutrition as healthy as possible. Eat less,